Welcome to the Total Shoulder Replacement Pre-Op Education class. My name is Sarah Hewitt. I'm a nurse and your care coordinator, and I'll be joined later by Dee Dee Decker, one of our occupational therapists. We have some information for our patient and visitors. We do ask that any visitors that come to the hospital are cold or flu-like symptom-free. Our main entrance doors open at 5 a.m. and close at 8 p.m. That being said, if you are coming in early for your surgery, the main entrance doors will be open, but if you have any visitors that are coming before 5 a.m. or leaving after 8 p.m., they will have to enter or exit through the ER entrance. You are allowed to have 2 visitors here during your surgery. One of those visitors can come back to the same day surgery area and sit with you until you go off for surgery. Once you get admitted to the hospital, if you're spending the night, you can have as many visitors as you want. There are no restrictions. Your one coach can spend the night with you if you desire, and we do ask that your coach wear their coach button, which looks like this. And one thing about this coach button is it'll, one, tell us that it's okay for us to talk to them, and then if they're spending the night with you, you are allowed to have one coach spend the night with you. We know that it's okay to talk with them. Class objectives. I want to make sure that you understand your procedure, what to expect during your hospital stay, the role of your coach. We'll talk about pain management, what physical and occupational therapy we'll be doing while you're here at the hospital, the expectations we have for you at home, the discharge planning, and the big purposes of this class is to ease your anxiety and answer any questions that you may have. The role of your care coordinator. As your care coordinator, part of my role is to teach the education class. I do daily rounds, so I'm here Monday through Friday, so I'll be popping in and checking in on you. I'm your advocate, so I want to make sure that you're having a good experience. Each morning I will meet with your nurse and case manager, and we will chat, and if there's anything needed prior to discharge, we'll get that arranged. And you should be getting some text messages pre-operatively before surgery, and then post-op with some reminders and checking in on you. If you are being admitted to the hospital, you will be up on our 4th floor. It's our dedicated ortho spine unit. Our staff went through special training, so they know how to take care of patients who are having a joint replacement. And we have all private rooms, so no roommates while you're here at the hospital. We have a rehab room that's on our unit, and you will see a tub shower combo in the picture. And our occupational therapists like for you to have a shower bench. What's nice about the shower bench is you can sit on the outside of the tub, swing your legs over, stand up, and you may not have the endurance to stand up for your entire shower, so it also gives you a place to sit. We do have a practice set of stairs that we will want to practice with you if you have any stairs at home. So why do you need that shoulder replacement? That poor shoulder is worn out, bone on bone, it's painful, the mobility is not there, you're not able to do the things you enjoy, so our goal is to get you back to a more healthier and fulfilling lifestyle. There are 2 types of shoulder replacements that we can do. We can do a total shoulder replacement and a reverse shoulder replacement. A total shoulder replacement is the same anatomy of your current shoulder. You've got your humerus with the ball and a socket. A reverse total shoulder is literally reversing the components. So where the ball was, we now put a socket, and where the socket was, we will now put the ball. I'm going to show you some models of what that will look like. This is the total shoulder. So you've got your humerus and the ball, and then you've got the socket. The ball will have a little short post in it to keep it in place, and then you'll have a plastic little cup that it'll fit into. But this is what it will look like. They're just gonna shave off all those arthritic areas and put this new part on. And then I'm going to show you the reverse. Looks a little different. So you've got your humerus with this metal piece and then the plastic piece. And then the ball that we use is either a metal or a ceramic. It just depends on your surgeon, what they choose. But they'll be screwed into place. So the ball will be screwed into place, and you can see that on the picture where it's screwed in. And then we have the plastic there because the plastic is what kind of replaces the cartilage that has gone bad. So it allows those 2 surfaces to slide nice and smoothly along each other. One thing about the reverse total shoulder is the rotator cuff is usually no longer repairable or non-functioning. So what will happen is instead of the rotator cuff moving the shoulder is now going to be the deltoid muscle that will move the shoulder. One thing with the reverse total shoulder is you may only be able to put your arm up to here. You may not be able to raise your arm all the way up. However, I have seen lots of patients be able to fully raise their arm after a reverse total shoulder replacement. That's where your job comes into play. Listen to your therapist. If they talk to you about certain exercises they want you to do at home, make sure you're doing those exercises, and that'll get the best range of motion possible. Be patient. It may take a year to recover after your shoulder replacements. There are some risk factors with joint replacements. Blood clots and pulmonary embolisms. We will go into those in more detail. Blood loss, stiffness or persistent pain, and your job with that is to listen to your therapist. When they tell you you got to do your exercises, definitely do that or your shoulder will get stiff. Scar tissue, everybody is going to scar differently. Your incision is going to be on the front part of your shoulder, of your arm. Neurovascular changes, there could be a little numbness around the incision, which is normal. If you have any underlying medical conditions or any problems with anesthesia, that's why we have you go through the whole pre-admission testing process and sit down with one of our nurses to get a full health history. Less likely complications to happen are damage to the big blood vessels and nerves, infections, problems with wound healing, and death. Just know these are less likely complications to happen. I want you to know that we take every precaution to make sure you have a safe and successful surgery. Let's talk about blood clots. We have deep vein thrombosis, a DVT, that can form in an arm or a leg. It's where the blood clot becomes so large that it blocks the flow of blood. A pulmonary embolism usually happens when the blood clot has formed somewhere in your body, a little piece breaks loose, it goes up through the heart and it gets stuck in the lungs. That one's a little bit more scary and life-threatening, and we're gonna go over all the symptoms of what to look for and how to prevent them in just a minute. Risk factors for developing a blood clot. Number one thing is inactivity. That is why day of surgery, we are getting you up, we're walking you that very day of surgery. Dehydration, if you think about being dehydrated, your blood is a little thicker and so it's more prone to develop a blood clot. Hospitalization, that is why you get to go home either that same day of surgery or that very next day. If you have a history of a clotting disorder, a previous blood clot, varicose veins with the inflammation, any kind of hormone therapy, cancer, obesity, smoking, and age can increase your risk of developing a blood clot. There are four main symptoms of a blood clot: swelling, redness, warmth, and pain. The swelling can be, and all the symptoms can be, it can be in the arm, it can be in the leg. If it's in the arm, really it can be anywhere in the arm. If it's in the legs, the calf, behind the knee, and the groin area are some landmark sites those blood clots tend to want to form. Sometimes the pain can feel like a muscle cramp, but a muscle cramp, you can walk that out. A blood clot pain's not going to want to walk out. It's just going to feel worse and worse as you start walking on it. And sometimes you don't have all the classic symptoms. You may not have swelling, redness, warmth, and pain. You could only have maybe pain or swelling, and it can still be a blood clot. So if you notice any of those symptoms that are persistent and they're not going away, definitely call your surgeon right away. Symptoms of a pulmonary embolism. You could have some shortness of breath, difficulty breathing, could have some pain in your chest or back, could be sweating, heart's racing, dizziness, confusion, passing out, coughing up blood, wheezing, running a fever, or feeling anxious. So how can you reduce your risk? I may have made you a little anxious. Well, exercise and early mobility after surgery is number one. We want you up, we want you moving. We don't want you sitting or standing for long periods of time. Usually every hour we want you up and changing positions, and no standing, more than 5 or 10 minutes this first week or two right after surgery, okay? Elevate your legs, avoid crossing your legs, controlling your weight. We like for you to wear your support hose. Now, this varies greatly by different surgeons. So some of your surgeons may not have you wear TED hose, some will. And so those TED hose may be worn for 2 weeks, they may be worn for 6 weeks. This is something that we will talk to you after your surgery. And we'll go over the TED hose as well in just a little bit. Also, you will be on some blood thinners, and a lot of times we'll just put you on an aspirin. It could be the 81 milligram aspirin twice a day or the 325 milligrams once a day. Also, if you're at higher risk, there could be a medication called Eliquis or Xarelto that we will use for your blood thinner. If you experience any symptoms of the pulmonary embolism or the DVT while you're here at the hospital, definitely let your nurse know right away. And if you get home and you're having symptoms of the blood clots in your leg, definitely call your surgeon right away. If there's after hours, then definitely go to the emergency room. But if you have any symptoms of that pulmonary embolism, definitely call 911 or whatever the quickest route to the hospital. We want you to look for signs and symptoms of infection. We don't plan on infection happening, but we want you to know what to look for. So if you start running a fever, having increased pain, swelling, redness, heat, any kind of abnormal drainage, any green, yellow, cloudy, thick, smelly drainage, or if your drainage is lasting over a week, you definitely want to let your surgeon know. Make sure you wash your hands before touching your incision. We do not want your pets to lay near your incision or lick your incision. So keep them away the best you can. If they sleep in the bed with you, we prefer them not to sleep in the bed. But if they do, put them at the foot of the bed, give them their own comforter, their own covers, and you just may want to change your bed sheets more frequently. We do want you to change your bed sheets at least once a week. Us as humans are covered with bacteria and we're constantly shedding those skin cells. So once a week, we would like you to put fresh bed sheets on the bed until you are completely healed. There's some preparations and lifestyle changes. So joint education class, you can mark that one off the list. Pre-admission testing, you will go to pre-admission testing 1 to 2 weeks or even 3 weeks prior to your surgery. We do want you to stop smoking and stop drinking alcohol. Smoking constricts blood vessels and softens bones, and so we definitely don't want that with a new joint replacement. And then alcohol is a blood thinner, so we don't want your blood too thin or too thick, and also alcohol is not to be taken with your pain medicine. We'll be doing some preoperative exercises, and in your case, it won't actually be exercises, it's just going to be practicing using one of your arms, because one of your arms will be in a sling, which we'll talk about further on in the presentation. And then again, weight management, just overall weight health will help with your recovery. During your pre-admission testing appointment, you will sit down with one of our nurses. They will go over all your medications. We want to know prescription and over-the-counter medicines. We'll do some lab work. We will do EKG if you're over the age of 50. We will do a chest x-ray if required. We will do a CT or MRI if you require any kind of special replacements for your joints. We do want you to stop taking those GLP-1 medications 8 days prior to your surgery. That would be things like Ozempic, Wegovy, etc. It's medications that help with weight loss. Are also diabetic medications. You may sit down with one of our hospitalists if required, and you may see one of our anesthesiologists. If you see them the day of your pre-admission testing, they'll talk to you about your general anesthesia, but if not, you will meet your anesthesiologist the day of your surgery. Medications we want you to stop taking 7 days prior to surgery because of the risk of bleeding are aspirin, Motrin, naproxen, Aleve, Mobic, Celebrex, garlic, ginger, fish oil, vitamin E, herbal medicines such as ginkgo biloba, ginseng. In your guidebook, there is a larger list of these medications that you can refer to. The other medicines are going to be those prescription blood thinners, so Coumadin, Plavix, Xarelto, Pradaxa, Effient, Eliquis. Make sure you do not stop those medications until your prescribing physician gives you the A-OK to stop those. The medication you can take prior to surgery is Tylenol. Tylenol is okay to take. And then make sure that when you come for pre-admission testing and for your surgeon that we do have an accurate list of your home medications. Good nutrition before and after surgery is vital for your wound healing. We want you to eat a well-balanced diet. Lots of protein and lots of vegetables are important. I said well-balanced, so get your grains, get your fruits. Restrict your sugar intake though, because just as with diabetics, it can slow down the healing of your body, of the joint, and so try to avoid eating too much sugar. We may check your hemoglobin A1C level, and what that is it shows how much sugar you have on your red blood cells over 2 to 3 months, so we can see how regulated your blood sugar has been. We want you to eat a heart-healthy diet, so staying away from those greasy, fried, salty foods. And if you do have any specific nutrition needs, such as gluten-free, dairy-free, please make sure your surgeon's aware, so if you are spending the night, we can get you on the correct diet. Your guidebook, so when you go for your appointment with your surgeon or when you go for pre-admission testing, you will get a guidebook. And this guidebook is full of frequently asked questions. It has a lot of information in it. It's split up into 3 sections. The first section's before the hospital stay, getting the house prepared. The middle section's while you're here at the hospital. And then the third section's all about going home. You can make notes in this guidebook. It is yours to keep forever and ever. If you remember, bring this with you to the hospital. Our therapists sometimes will review the exercises that are in the guidebook with you, and then also bring it to your surgeon's office for your follow-up appointment because they may give you a picture of your new shoulder. And you can just stick it in this binder. There's a nice front little pocket that you can stick all that information in to keep it all in one spot. Choosing your coach. Your coach can be a family member or a friend. They're going to provide comfort, safety, motivation. They know your baseline. They can watch therapy sessions while you're here at the hospital. Then both you and your coach will gain the confidence that your coach can take care of you. We are a non-smoking facility at Stonecrest, so no one is allowed to smoke here. For our visitors, our cafeteria is open Monday through Friday for breakfast and lunch. We're closed every day at dinner and we're closed on the weekends. That being said, if your coach is here and they don't want to leave, we do have vending machines in the cafeteria. We have the Sam Ridley, a lot of restaurants that deliver nowadays. And then the other option is to purchase a meal ticket at the information desk. With that meal ticket, that will allow them to order off the menu with you when the cafeteria is closed. The cafeteria only accepts debit and credit cards, no cash. If your coach only has cash, the information desk accepts cash for a meal ticket, so they can purchase a meal ticket and use that meal ticket also in the cafeteria. Pre-surgical preparations, things we want you to bring with you. A positive winning attitude. We want you excited about having this shoulder replacement. I know having a shoulder replacement was not in the bucket of things to accomplish in your lifetime, but we want to get you better and do some of those things that might still be in the bucket. We already talked about bringing your guidebook, bring your insurance card and ID. When you go through patient registration and pre-admission testing, we will get a copy of that. We will not ask for it when you come to the hospital that morning of surgery, but it's always a good idea to have your coach hold on to it. If you have sleep apnea and use a CPAP or BiPAP machine, definitely bring that with you to the hospital. You're gonna have anesthesia on board, some extra pain medicine you're not used to, so when you do sleep, you're going to get into a deeper sleep. Make sure you check your CPAP machine, check the wiring, make sure there's no frayed wires, the tubing, there's a small little filter that you might need to change. Our biomed technician will take a look at it to make sure it's safe to use. If you have a favorite pillow you can't sleep without, definitely bring that pillow with you. If you bring your pillow, stick it in a pillowcase other than white. Our linen is white and we don't want you to forget your favorite pillow. If you have your cell phone with you, make sure you bring the cell phone charger, any hearing aids and their batteries, any hygiene items. We carry most hygiene items here. We don't carry deodorant, like toothpaste, toothbrush, stuff like that. We don't carry deodorant because it's not compatible with the CHG wash that we use on our patients, but after surgery, you're more than welcome to wear deodorant, so make sure you bring your deodorant if you want to wear it. Extra loose fitting button-up shirt or t-shirt. So you will be in a big brace and you're not going to have a whole lot of movement allowed with your surgical arm, so we want something that's either a big extra large button-up shirt or something that's really stretchy that we can easily get it over your arm. As far as your bottoms, bring some comfortable pajama pants or shorts. We also want you to bring some comfortable walking shoes. We do not like Crocs or flip-flops at the hospital, and avoid those tight-fitting shoes. We want you to remove your nail polish. We want to make sure that you protect your arm from any cuts or burns. That is an open area for bacteria to enter your body. We like for you to have your first outpatient therapy appointments scheduled prior to surgery. Now, some of your surgeons may not have you start therapy until after your follow-up appointment, which is totally fine. But if they do want you to start your physical therapy outpatient before that, we do like you to have that first therapy appointment arranged. That way you get the place you want to go and the time frame that you prefer. Newsletters, daily homework, and coach's checklist. This is what I like to review with you when I come to see you. I call this the Cliff Notes to come into class. It goes over, what to expect, and our expectations for you. Incentive pathway, this is also in your guidebook and it is in your room. It's a dry erase board and we'll be checking off those goals to achieve prior to discharge. Enhanced Surgical Recovery. It's a research-based program that we adopted, and basically involves you more as the patient in the surgical experience, and it helps, as you can see on the screen, so many different ways. The night before and morning of surgery, we do not want you to eat anything after 11 p.m. the night before your surgery. Now, you may have clear liquids 2 hours prior to your arrival time to the hospital. Now, that could change based on you, your surgeon, so just make sure you're listening to the pre-admission testing nurse, and they will let you know about the clear liquid restriction. But just for now, plan on clear liquids 2 hours prior to your arrival to surgery. You may take medication as instructed with your clear liquids, and also you may receive a carbohydrate drink. This is the carbohydrate drink that you will receive when you go through pre-admission testing. Now, if you're a diabetic or you're on the GLP-1 medications, you will probably not get this carbohydrate drink. Now, you'll see that it says Ensure. It's not the Ensure you buy at the grocery store. It is a pre-surgical clear liquid beverage. So you will drink this last at that 2 hours prior to arrival. If you do not get the carbohydrate drink, then you can do a sugar-free Gatorade, sugar-free Powerade that morning, as long as you're allowed to have those clear liquids. If you are taking the GLP-1 medications, we actually do not want you to have anything to eat or drink for 12 hours prior to your surgery. We would like for you to get a good night's rest, remove any jewelry, any body piercings, any kind of metal can cause a spark and burn you. We don't want you to wear any deodorant. It's not compatible with the CHG solution that we're going to apply. Speaking of the CHG wash, we want you to shower with the CHG solution provided to you at pre-admission testing. It'll come with this little plastic mesh sponge and the wash. How to use this is you'll get in the shower, you're gonna suds up your entire body, avoid your face, your hair, your private areas, suds it up, let it sit for 2 minutes, and then rinse it off in the shower. Make sure you're drying off with a freshly washed towel. Don't put any lotions or perfumes on your skin because that'll deactivate the CHG from working. We also don't want you to shave your legs or your neck for about 2 days prior to surgery, because if you try to put the CHG solution on freshly shaved skin, that can cause some skin irritation and burn. And then also we don't want any accidental cuts prior to surgery, because that could delay your surgery and have an open sore. Be sure to have clean bed sheets on your bed the night before surgery, because you're going to disinfect your entire body, and so you want to get into a clean bed. During your pre-admission testing appointment, we will do a nasal swab to test for MRSA and MSSA. If you test positive for that, we will be doing the CHG wash for 5 days prior to surgery and the morning of. If you don't test positive, you will be doing it the night before and the morning of. If you test positive for the MRSA or MSSA, your surgeon will prescribe an antibiotic ointment called Mupirocin, and you will use that twice a day, 5 days prior to surgery, and we want that last dose to be the night before your surgery. If for some reason you're not able to get the full 10 doses, the 5 days worth of Mupirocin, and you do need to take a dose that morning of surgery, we don't want you to take that dose, skip that dose. We will be putting something else in the nose to kill all that bacteria. Also, if you do have the positive MRSA or MSSA, bring that tube of Mupirocin with you to the hospital. And then you also have that checklist that is in your bag that pre-admission testing will give you, and that'll keep you on track to do your CHG wash and your Mupirocin. The day of surgery, you will check in at the registration desk just like you do for pre-admission testing. You will go back to our same-day surgery waiting area. We will come and get you as the patient, have your coach stay out in the waiting room, and then once you get prepped and ready, we'll let your coach come and sit with you until you go off for surgery. When you get to our same-day surgery area, we will have you change into a hospital gown. We will have you apply some CHG wipes. So it's the same ingredient as the wash, except it's going to be in a wipe form. There's a diagram on the slide that you see there, and your pre-admission testing nurse will show you how to put them on, but there are 6 wipes total, and each wipe is a different body part. We will also be doing a nasal antiseptic. It's povidone iodine, and that will kill bacteria in your nose for 12+ hours. During same-day surgery, we will be doing a head-to-toe assessment. We'll be putting TED hose and SCDs. So for your TED hose, you will have knee-high TED hose. And so these will go up to right below the knee. We don't want them above the knee because they'll start bunching behind the knee. So put them right below the knee, and then pay attention to them throughout the day because they can start bunching up around the ankle, and that bunching up causes poor circulation versus helping with the circulation. So these are the TED hose you will wear for 2 to 6 weeks, or your surgeon may not require them at all, but you will have them on for your surgery. You will also have the SCDs, the sequential compression devices, and these are Velcroed around your calves, and they fill up with air, and they'll squeeze one calf and then the other. This helps with circulation, and I call these your free leg massages, so you get some massages while you're here at the hospital. We will start an IV for your surgery because that's where a lot of your sleepy medicine will go. We'll give you any preoperative medication and any antibiotics. We'll be asking you questions over and over. Tell me your name, your birthday, who's your doctor, what are you having done? It's not that we don't know, we just want to make sure we're all still talking about the same thing. You will see one of our anesthesiologists and your surgeon that morning of your procedure, so any last minute questions you may have for them. And then your surgeon will also mark your surgical site. So as another safety measure, we can make sure we're operating on the correct body part in the operating room. To help with pain control, we will do an axillary nerve block. That will be performed over in our recovery room, a little holding area that'll be put in prior to your surgery. And what it is going to do is going to numb that entire arm. So when you wake up from surgery, the pain is definitely going to be lessened. I will warn you that when you start to get that mobility back in your hand, that's the time to start taking your pain medicine. Your joint replacement will take about an hour to an hour and a half, but just know you'll be in the operating room about 2 to 2.5 hours. That time that's extra is the time it takes us to get you in the room, get you prepped, get you positioned. Sometimes there are delays, and if there are any delays, our same-day surgery nurses will definitely keep you informed the best we can. During and after surgery, your coach will go back out into the waiting room. We do have Wi-Fi available so they can hook up to our Wi-Fi, get on their iPad or laptop. The coach will get updates once you get in the OR as surgery is getting started, each hour you're in there, and as surgery is wrapping up. There's also a TV tracker in the waiting room where your coach can see your initials and see where you are in the process. It's important that anybody calling into the hospital has that 4-digit passcode you will receive when you go through pre-admission testing. If you don't receive it at pre-admission testing, you'll receive it the day of surgery. But we will ask for this 4-digit passcode when someone's calling in to check in on you. Your surgeon will speak with your coach after your procedure's done, give them an update on how you did. They will typically call on the phone, or they may go out into the waiting room. If they're calling on the phone, please make sure that the operating room nurse knows the number for your coach who you want the surgeon to call, and make sure your coach is answering all the calls that are coming through their phone so they don't miss the surgeon calling them. The cell phone signal in the waiting room is sometimes not that great. It's a little weak, so we ask that if the cell phone signal is weak, that you hook up to our Wi-Fi and enable Wi-Fi calling. Our staff in the waiting room can definitely help get that set up if you're unsure. Also, a way for your loved ones to stay informed is they can log into, well, text this informer, and what they'll need is the phone number that's listed on the screen. They will need to know your 6-digit account number and your date of birth, and that will get them in a system that'll automatically send them text messages on where you are in the process. This is the same information that will be located on the tracker in the waiting room. Recovery room, also known as PACU, that is where you will wake up after surgery. If you are spending the night, you will be on a hospital bed. If you have a history of sleep apnea or any cardiac issues, you may have a heart monitor on. You'll be in recovery room 1 to 2 hours, just depending on how quick you're waking up, how much pain medicine you're needing. We'll be monitoring your vital signs, heart rate, blood pressure, oxygen, respirations. We want to make sure you're waking up well. If you are spending the night, you'll be getting your vital signs on arrival, and then every hour times 3, and then every 4 hours after that. We'll be doing a neuromuscular assessment making sure everything's moving well. So we'll have you move your arms and move your legs. We'll get your pain control down to a tolerable level. You may have a little bit of a sore throat from the breathing tube, from general anesthesia. Your coach is kept up to date during this time. Your coach could not see you in the waiting room. The next time your coach will see you is upstairs in your room if you're spending the night. And at this time, the recovery room nurse will call your coach and let them know what room number you'll be going to. So how are you feeling after surgery? You probably will have a decrease in energy level, so it's important to balance your rest with activity. You probably want to limit the amount of visitors that are coming to see you. Anesthesia may take a few days to get out of your system, so you may remember little to none of the hospital stay and even a couple days at home. You want to begin with light foods for your first meal. Your stomach is still waking up from anesthesia, and appetite could take a few days or even weeks to get back to normal, but try to make yourself eat the best you can, all those good nutrient foods to help with the healing process. We say call, don't fall. After surgery, you are at increased risk for falling because you've had anesthesia, you're on pain medicine, you have an IV in, you may have a drain, an ice pack, compression devices, those SCDs. You may have some impaired mobility due to weight bearing and strength. So what to expect, you're gonna have some yellow socks on. So these bright yellow socks on with the grippers. We'll have a gait belt. And we will send home one of these gait belts with you if you don't already have one, and this will be applied just whenever you get up in the morning as like an extra little handle for your coach, just in case you get a little unsteady. We will be putting your bed alarm on because we don't want you to be getting up by yourself, and we'll be rounding on you on a regular basis. The expectations we have for you is we want you to press your call light. Even if you have to get up to go to the bathroom every 30 minutes, we honestly would rather be in there every 30 minutes to help you than you try to get up and out of bed by yourself. This is the pain scale that we will ask you to rate your pain on. It's from 0 to 10. 0 is no pain, 10 is the worst pain imaginable. For pain management, we do a multimodal pain management approach, which means we're not going to just give you narcotic pain medicine. We may be giving you some Tylenol and an anti-inflammatory and maybe a nerve pain pill. But studies have shown part of the ESR program is that when we give you different types of pain medicine, they all work together and they don't make you as sleepy if we were to just to give you the narcotic pain medicine. This will be a new kind of pain. It won't be the bone-on-bone arthritic pain. It will be more of a surgical pain. We do want you to intercept that pain before it gets severe. We have your pain medicine ordered PRN, meaning as needed, so you will need to ask your nurse for the pain medicine when you do want it. We want you to take your pain medicine on a regular basis. So take it at regular intervals, especially this first 3 days after surgery. You want to take pain medicine at least 30 to 60 minutes prior to going to therapy, and then make sure you're taking your pain medicine at bedtime. While you're here at the hospital, please let your nurse know if what we're giving you is not working, and then make sure you understand all the pain management efforts that are in place. A side effect of the pain medicine is constipation, so you will be on a stool softener. So we want you to take a stool softener and make sure you stay hydrated and be mobile, because all that will help keep you regular. Remember, we can't make the pain go completely away. Our aim is to manage that discomfort, allow you to eat, sleep, and get home as soon as you can. We do all we can to ensure comfort and safety. What that means is if you are too sleepy or your blood pressure is too low, we cannot safely give you any pain medicine. Don't worry about getting addicted to the pain medicine as long as you're taking it as prescribed. Taking it as prescribed means you're hurting. Being in unnecessary pain will actually stress your body out, tense up those muscles, and slow down your healing. Pick one day each week to measure your progress. And just know everyone's experience is unique and different. You may have heard horror stories of your friends having a shoulder replacement. Don't think that's going to be you. Everyone's experience is different and unique. We are here and committed to making your surgery a success. It is now time for a break. I've given you lots of information, so you can choose to pause the video now. After you come back, Dee Dee will talk about what to expect after your surgery.
Welcome back. My name is Dee Dee and I am the lead occupational therapist here at Stonecrest. We're now going to talk about your recovery after surgery. Physical therapy will start the same day as surgery, post-op day 0. They care about your lower body function. So getting in and out of bed, climbing and descending stairs, and walking. You shouldn't have any trouble with that following your shoulder surgery. Now, occupational therapy will see you post-op day 1. That is important because we want to make sure you are able to perform all of the functional skills necessary in order to improve your independence at home while maintaining your shoulder precautions. This includes dressing, bathing, and toileting. Let's talk about a few medical devices that you will see while you're here at the hospital and following your surgery. First and foremost, let's talk about your shoulder immobilizer. This is something that you will be wearing for the first 3 weeks at least after your surgery. The bump, as you can see on the screen, is removable and you can wear it to your comfort. The biggest suggestion that I have when wearing your shoulder immobilizer is to make sure you're always able to see your elbow, and that will ensure that you keep your arm in neutral. Let's talk about a few other devices that you will see. First and foremost, this is your pulse oximeter. This is something that attaches to one of your fingers and measures the amount of oxygen in your blood as well as your heart rate. Next are TED hose. These are compression stockings that you will wear for the next 4 to 6 weeks in order to encourage blood flow back through your body. You will all wear knee-high TED hose. Now, if you have any questions about donning these TED hose, please ask your occupational therapist and they will show you a trick to getting them on. Speaking of encouraging blood flow through your body, you also will wear these. These are SCDs that go around your calf and attach to a little medical device at the end of your bed. They will also pump up and contract that calf in order to encourage that blood flow throughout your body. This is our gait belt or our safety belt. We put it around all of our patients in order to help prevent falls. It goes around all of our patients' waists, and we use it as therapists in order to hold on to you while we're walking. If it looks like it's inside out, it's actually on correctly. This is our incentive spirometer. Everybody who has a surgery here at Stonecrest uses this. It is what we use in order to help open up your lungs after surgery to prevent pneumonia. What you're going to do is you're going to suck in through this tube in order to raise the volume of air in this large canister. You will suck in 10 times every hour, and after your 10th time, you'll follow it with 2 good coughs. You will perform this every hour that you're awake for 5 days following your surgery. Finally, we are going to talk about our Polar Cube. This is our ice machine that everybody who has a shoulder surgery gets. And it is a giant ice machine. This filter filters ice cold water to your ice pack. How do you make the ice cold water? Well, you fill it up with about 1/3 of the way with water and then the rest of the way with ice. Sometimes that ice can cause a mess. So we suggest that you freeze water bottles in your freezer and put about 4 of them in here, and that way, when it's all melted, you can take them out and refreeze them. Now, how do you put this on your shoulder? This is your ice pack, and it will go over the incision on your shoulder. It also comes with a Velcro strap that you will be able to strap all around your body in order to secure it in place. One thing we suggest is that you do not put this ice pack directly onto your skin. Please use some sort of barrier, like a shirt, a tea towel, a pillowcase, something like that, so your skin does not burn. Let's talk about your post-op surgical dressings. A few surgeons like to use this Mepilex dressing. It is an antimicrobial silver nitrate dressing that you will go put on to cover your incision. It is waterproof and safe to shower in. Some of our other surgeons prefer to use a Tegaderm dressing with a white pad. This is also safe to shower in, but we specifically ask that you do not soak with either of these dressings and do not spray water directly onto these dressings. This is George. He is our lead physical therapist. And this picture is just to show you that if people with those colored scrubs walk into your room, be prepared to do some work. We have a few goals that you have to meet in order to go home following your total shoulder surgery. We want you to be able to get out of bed on your own, walk up and down the hallway at least 100 feet using your rolling walker, climb and descend the amount of stairs necessary to get into your home, be able to recite all of your shoulder precautions, and be able to get dressed and go to the bathroom with little to no help. We also want to make sure your pain is controlled with oral pain medication. Let's talk about our reverse total shoulder precautions. We need to make sure that you wear a sling for at least 3 weeks. You can or cannot choose to wear the bump, but you have a lifetime lifting limit of 25 pounds with that reverse total shoulder. This is because your rotator cuff is typically irreparable or you have severe osteoarthritis. Pain relief is your main goal for having this kind of surgery. For our total shoulder precautions, we also want you to wear your immobilizer for at least 3 weeks. You can choose whether or not to wear the bump as well. Now, your precautions are definitely depending on if your rotator cuff is repairable or if your subscapularis has been repaired. Some helpful tips with any total shoulder surgery. You can always support your elbow with a pillow underneath, especially while you're in the recliner or laying in bed. Do not sleep on your operative side. We really ask that you follow that rule at least during the first 3 weeks of your recovery. You should always see your elbow, and no matter what you're doing, that keeps your arm in a neutral position and allows for the best healing. Again, do not lift anything more than 25 pounds for the rest of your life if you have had a reverse total shoulder surgery. Right now, your weight-bearing status for this surgery is non-weight bearing. That means you cannot push up through your arm or put any weight through your operative extremity. We ask that you do some sort of wrist movement as well as some squeezes with a ball that you will receive with your shoulder immobilizer. Some of our patients get really frustrated with how slow shoulder recovery takes. It can be very slow, but I promise it is worth it. Listen to your outpatient physical therapist as they will monitor your progress. The day after surgery is typically your discharge day. We want to make sure that you are dressed and ready to go while following all of your shoulder precautions. Your case manager will also come and make sure your outpatient therapy is set up. Once you return home, some assistive devices could be beneficial to you, specifically the shower chair. Because you have undergone a major surgery, it could be really beneficial to have something to sit down on during our long showers. Everybody tends to get dizzy and lightheaded with heat, and so it would be really beneficial to sit down rather than trip and fall and re-injure your shoulder during a shower. Occupational therapists will review all of the assistive devices that could be beneficial to you during their initial evaluation. Some of these things could be really beneficial and some of them might not. If they are, they will suggest these different devices to you during your recovery. So here are a few guides for our daily activities. Use any assistive device that you were already using pre-op. And please put away anything that could be a tripping or a fall hazard once you go home. We want you to sit in comfortable recliners or chairs with armrests that are easy to push up from your non-operative extremity. Please gather all clothes prior to dressing and dress your surgical arm first. Wear slip-on shoes like Skechers slip-ins or New Balance robes in order to help you dress your lower body following this surgery. Do not soak in a bathtub until your incision is completely healed. We love for you to keep active and walking even after this surgery, but also take time to rest. Your body is recovering. It's important to nap and rest as you are recovering from this surgery. Bruising and swelling is not uncommon. Do not be alarmed if you're experiencing any of these in your operative extremity. We like for our Polar Cube to stay on for the first 72 hours 24/7 in order to control your pain and swelling. From then, you want to wean yourself to about 20 minutes on, 20 minutes off until the end of the week. After that first week, we would love for you to use it as needed. Always prepare to use your Polar Care pack after your outpatient therapy sessions. We don't have any specific pre-op exercises for you, but we would love for you to start practicing with your non-operative arm to feed yourself, dress yourself, brush your teeth, and comb your hair. Please use your preferred pharmacy when going home. Restrictions might apply to those narcotic pain medication, and if you have any difficulty getting those, please contact your surgeon. Have your ride ready to pick you up around noon. Typically, that's when we like to discharge our patients, so plan to eat lunch here and then go home. Speaking of a ride, make sure you have someone that's able to help care for you for at least that first week following your surgery. And not just you, pets can unintentionally cause falls, so please have somebody caring for your pet during your recovery. They might even put them away in a separate room until you are settled at home, and then they can come and greet you when you are safely seated. Xarelto and Eliquis are blood thinners that your surgeon might prescribe if you are allergic to aspirin. If you are prescribed this, we will contact your case managers so they could possibly give you a coupon that can help with that cost. Your follow-up appointment is in about 2 to 6 weeks, and if staples were applied, they will be removed in 10 to 14 days. You are not allowed to drive until you are cleared by your surgeon, and the lifespan of your new joint is 20 to 25 years. Pick one day a week to track your recovery. We know that with this major surgery, you are going to have highs and lows, good days and bad days, and sometimes you won't be able to do the things you were able to do the day before. That's why we encourage you to pick one day a week, let's say Tuesday, and measure your progress from last Tuesday to this Tuesday. This is much more encouraging to you as you go through the recovery process, as well as your family. If you're using Medicare, this surgery is considered a bundle payment, which means your entire surgery and hospital stay is bundled together and given to insurance to pay for. This means they will not pay for any elective procedures within the 90 days following your surgery. So if you have a colonoscopy, EGD, or MRI, please either try to schedule it before your surgery or push it to 90 days following the surgery so you don't receive a bill for something you shouldn't have to pay for. All of our surgeons require that you now take an antibiotic prior to any dental procedure for the next 2 years. There are a variety of dentists here in Middle Tennessee, and please talk to your dentist to see what their protocol is for receiving these antibiotics and taking them. If you would like to make an ice pack, you can always combine equal parts rubbing alcohol and water into a plastic bag. I always double bag it to prevent leakage, and freeze it in your freezer for a few hours. It makes for a great ice pack in case your Polar Cube is not doing the trick. Once you go home, we encourage you to create a home base. Have everything you might need within arm's reach, including your phone, water, snacks, the TV remote, but make your pain medication a little bit hard to get to. Sometimes getting up and moving can ease that pain. We know that going to a skilled nursing facility is a thing of the past because you recover better at home. And that's where we would like for you to go. But if something were to happen where you are unable to go home after surgery, you will have to spend 3 nights here at the hospital with us. And that is not our rule, it is the rule insurance has. We just want you to be aware if that situation arises. If you feel like decisions are being made about you, if you're discharging too early and you don't agree, please talk to us. We know this is your surgery and we want it to be as successful as possible. We would like to invite you to our reunion lunch. It is held once a quarter in our medical office building and filled with patients just like you who have received a total joint surgery. It is a great time to fellowship with one another and share stories about your recovery, as well as let team members like myself see your progress. If you come in contact with a wonderful staff member here at Stonecrest, you can nominate them for the following awards. The Daisy Award is for exceptional nurses. The Rose Award is for exceptional staff members, such as therapists, EVS workers, and dietary staff members. And the Physician and Mid-Level Award are for our physicians, surgeons, as well as our PAs and nurse practitioners. My Health One is our online patient portal. It is what we use to track all of your hospital records, including this surgery experience, as well as hospital bills. We encourage you to create a login on TriStarStonecrest.com or MyHealthOne.com. We love to see our patients progress, but we really encourage you to only photograph or video your patient. If you have other people within those photographs or videos, you must receive verbal consent from them in order to take those photos or videos. You will receive a Press Ganey survey following your hospital stay. This is our patient satisfaction survey. We want to know if you had a wonderful experience here at Stonecrest. And we definitely want to know if you didn't have a wonderful experience, because we don't know what to change unless you tell us. You can also review us on Google, Facebook, or Yelp. And thank you for coming to Joint Class. I appreciate the time you've spent with me today. And if you have any questions, you can contact Sarah at the number below. Thank you.